Hello dear friends, I Dr. Singh welcome you all to my YouTube channel Pharma Learning. Today I will discuss with you about important topic, that is anesthesia and euthanasia in case of zebrafish. That means if you are using zebrafish during experimental work, which type of anesthetic you can prefer and which type of euthanasia techniques you can prefer. So basically I will discuss with you some of the basic concept that why we prefer anesthetics in animals and why we use anesthetics. The first thing, that which type of anesthetics we should use, and the second thing, how they will be preferred, because there is a lot of questions which are related to anesthetics. The reason is there are so many, you can say, experimental things. Whenever you will perform with the small animals like a zebrafish or some other, then it is necessary that we need to anesthetize the animal. The reason being, if you will not anesthetize, the major thing will be a pain. So that means, as per ethics and as per the rule and regulation of various ethical committees, there is a prohibition that we never cause pain to the experimental animals. Even in this particular lecture, I will discuss only about the zebrafish. In the next lecture, I will discuss with you that how you can use anesthesia in experimental animal, and the second thing, which type of anesthetics are preferred in rodents and non-rodents, how they are preferred, and what are their side effects. In this case, today's lecture, I will discuss with you that which type of anesthetics you can use in your lab in zebrafish, how you can prefer these anesthetics depending upon your experimental work. Why I am saying experimental work? Because you know that there are number of surgical techniques which has been used on the experimental animal. The duration of anesthesia and the duration of your experiment, they are having a lot of, you can say, a link. Now what is the link between these two? What is the lot of things which are there between your choice of anesthesia and your experimental work? The basic thing which is required to be noted on, that whenever you will prefer any kind of anesthetic, you should firstly learn that which type of experiment you are going to perform in zebrafish. Suppose if your experimental duration is only for 1 to 2 minutes or 5 minutes, then you should choose a such type of anesthetic substance which can provide the anesthesia to the animal for 7 to 10 minutes. Considering one thing, that animal should not be freeze. Second thing, animal will not undergo hypothermia. Third thing, animal respiratory rate should not be declined. Fourth thing, the animal cardiovascular system will not be collapse, or either there will be a no decrease in excessive heart rate and your cardiac contraction rate. Now, the things to be noted, that whenever you will prefer any kind of anesthetic in the zebrafish, if you will freeze your fish for a long time, what will happen? The chances of death are more. The reason, if you will freeze it by using some specific technique, what will be there? The fish will undergo hypothermia. Now, hypothermia can be due to your anesthesia. Hypothermia can be due to the medium water which you are using in the tank. Hypothermia can be due to some conditions if you are not maintaining the laboratory temperature and some humidity like conditions. Now, the third thing is respiratory rate decline. Now, suppose if the fish will undergo hypoxia, then you can easily say that death was due to hypoxia and it was due to reduced respiratory rate. The third thing, if there will be a decreased pulse rate or the heart rate in the zebrafish, then again it can be due to anesthesia, overdose, or it can be due to some other factors which will be there. So whenever you will prefer any kind of anesthetic in the zebrafish, you will take care that which type of experiments you are going to perform, because these anesthetic can interfere with the behavior of the zebrafish. How they can interfere, I will discuss you. Suppose there are number of experiments on the CNS or on the other system in which we particularly focus on the behaviors. Suppose if you will say that I want to note down the behavior of the zebrafish, and now you are thinking that I will give some kind of anesthetic because I want to orally administer a drug to zebrafish, or I want to administer or inject a drug to zebrafish intraperitoneally, either orally or either you are doing surgery in which you are giving injection intracerebroventricularly. Now, in this case, if you will not select a appropriate anesthetic, the problem will be the chances of the mortality rate in zebrafish will be high. Now, it will not be by a single factor, it can be due to by a number of factors. So that's why the aim of using anesthesia is not only to reduce the pain, the aim is to carry out your experimental work, to carry out your surgery very safely. So this is necessary that whenever you will select anesthesia, you will firstly choose a specific dose. Now, dose is the major thing in case of anesthetic. Suppose if you are calculating a dose, basically the body weight of zebrafish lies between 400 mg to 600 mg. So likely suppose if you will select that the zebrafish weight is 400 mg and you are thinking to give it any of the anesthetic, like you can say you are giving a thiopental sodium, or you are giving any other, you can say hypothermia by coldness, or you are giving any drug, suppose. Now the first thing, how you will select the dose of the drug, because in case of experimental animals like rodents, suppose you know that we use 80 mg per kg intraperitoneally thiopental sodium, suppose you are using. Now either you can choose this particularly mg per kg dose for the zebrafish for the weight of 400 mg, or you can select any particular paper which is already published and they have used the specific dose of anesthesia in the zebrafish. Now if you will not select a appropriate dose, suppose you are giving a high dose of the anesthetics to the zebrafish, what will be there? It will not only alter your experimental interpretations, it will also alter, or it will also cause the increase in rate of mortality in the zebrafish. So I will discuss with you that which type of anesthetic and which type of euthanasia techniques are preferred in the zebrafish, the first thing I have already discussed, that pain is the major thing that is need to be not be there, because pain causing to the animal is against ethics. So that's why we should avoid, we should reduce the pain by using these type of the anesthetics. So what is anesthesia? Because there are two type of anesthesia. You can say you are giving anesthesia by any oral route, IP route, or any other route. And the second thing of anesthesia is you are giving a anesthesia by inhalation route. But the third type, which is preferred in the zebrafish, is a cold temperature induced anesthesia, in which you keep the temperature of the water, you will use a ice water, and the temperature will be around 0 to 4 degrees centigrade. So this temperature, which is called as a cold induced anesthesia, this is a third type of anesthesia which is preferred in case of zebrafish. So analgesics, the substance which are used to reduce the pain. Euthanasia, it is the process by which we can give a good death to the animal. So that mean you mean good, athesia mean death. So it mean we will cause the death of animal, but in a better way, without producing any kind of pain or without producing any kind of other sensation. So these things are very important to be noted on whenever you will perform the experimental work. So why euthanasia is required? The certain things are there because death without causing anxiety, painless distress is the minimum. Now there is a one another thing I will tell you, that suppose if you are causing a euthanasia and you are working on cardiovascular system, you are working on ischemia reperfusion injury, or you are working on, you can say, hypertrophy of the ventricle, or you are working on any other disorder which is related to the cardiovascular system. Suppose you are killing the zebrafish, and you know that whenever you will try to kill the zebrafish, zebrafish without anesthesia will undergo stress. Now if it will undergo stress, it there will be a release of stressors. Now, these stressors like adrenaline, norepinephrine, like that, these substances immediately increase the heart rate of the zebrafish. And your interventions are, you want to check the heart rate, or you want to check the cardiac hypertrophy, ischemia, reperfusion injury, like that. Now, suppose if you are giving a stress, these all parameter will be vary in case of animal. So you should note it down that whenever you will perform euthanasia and afterward you want to check the pathological changes in the body of animal, you should avoid these type of the stress. Otherwise, it will cause some of the pathological changes that you cannot understand, that these pathological changes are due to some drug which I have given like toxin, or it was due to some other factors. The second thing, minimum physiological and psychological disturbance. This is the benefit. Capability with the purpose of study minimal emotional changes in the animal. Location should be separate, because this is very important, because in the next lecture I will discuss about the rodents, and this location and the particular apparatus which you are using for killing the animal is very important, because one animal once you kill, the second will easily get a cue about that, and second will be alerted, second will be hyper. Now this is the condition in case of animal. Two-step euthanasia should be placed in the fishes, and physical technique of euthanasia that can easily be useful and that is required. Now, why this euthanasia is required? This was a second question. Why this is required? Suppose if you are working in such type of the experimental technique where you need a brain of zebrafish, where you need a heart of zebrafish, lungs of zebrafish. Likely it depends upon the target where you are targeting your research. Now in this case, you want to take the organ for the histopathological analysis, for the immunohistochemistry analysis, for the biochemical marker estimation, for the inflammatory marker estimation, or for using some Western blot or RT-PCR techniques. In this case, it is must that you should firstly euthanize the animal before taking any organ of the that particular zebrafish. Now these are the anesthetics which are very important, and the dose of these anesthetics are as per the guidelines of the animals. You can say as per INSA, as per CPCSCA, as per you can say institutional biosafety committees. These are the dose and various anesthetics which are preferred. Now first anesthetic which is preferred in the adult zebrafish is tricane methasulfonate. This is at a dose of 200 mg per liter. Because you are having a fish in a water, then you can easily drop down the dose of this anesthetic into directly into the water. The second is clove oil, because it contains a eugenol. Eugenol is having a anesthetic property, and this clove oil at a dose of 100 mg per liter is used, because you know that it reduces the loss of pain and painful sensations. You know that whenever clinically you know we suffer from toothache like that, we always place a clove in the side of our oral cavity, because this eugenol is having a pain killing as well as anesthetic properties. Second is a lidocaine, which is very useful in case of zebrafish as well as in other animals at a dose of 400 mg per liter. The fourth one is 2-phenoxyethanol. The dose is 800 mg per liter. And the fifth part is a hypothermia. Hypothermia means you are keeping the zebrafish in a ice cold water, and suppose what you can do, you will take a beaker, and in the beaker you will put some ice. Now once the ice will become liquefied, liquid will be present, you put one zebrafish here, and you will see that due to hypothermia within 4, 5, 10 seconds your zebrafish will start to freeze, and you will easily get the anesthesia. This particular type of the technique where you keep the zebrafish at 0 to 4 degrees centigrade is very useful if you are giving intraperitoneal injection to the zebrafish, or if you are administering a orally drug to the zebrafish by using some cannula, or this is useful if you want to take a body weight of the zebrafish. This is a very useful technique. So hypothermia is also used in zebrafish. What you can use for larva? If you are working on a larva, in a larva you can use tricane methasulfonate, but the dose will be 1800 mg per liter, because you know that larva are small fishes where there is a need of high dose due to in excessive their metabolic rate is more. So that's why you need a high dose of this tricane methasulfonate. Then clove oil, which contain eugenol, isoeugenol, will be a dose of having 1500 mg per liter. And this particularly hypothermia you can do in case of small larva also. What you will do, you will keep the temperature of water 0 to 4 degrees centigrade, and you can put a larva there and you can do your experiment. So these are the techniques which I have discussed with you about the zebrafish. In the next video, I will discuss with you what are the anesthetic and what are the techniques of euthanasia in experimental animal, and what are the side effects of the anesthetic in the large experimental animal. So you should like, subscribe and watch this pharma learning channel. You all are welcome. Thank you very much.